Hi, my name is Laura Hoffman. I am a nurse practitioner at the Coshocton Surgery Clinic. I'd like to talk today about colon cancer screenings. Until very recently, colon cancer screening started at age 50, but the guidelines changed a few years ago, and it's actually recommended now that screenings start at age 45 for people of average risk. Unfortunately, they changed the guidelines in the middle of a global pandemic, so many people weren't aware that the guidelines have changed and don't realize that they're due for a screening. So people of average risk, that includes people that do not have a history of colon cancer, they don't have a history of polyps, no family history of colon cancer, no history of inflammatory bowel disease or genetic diseases that predispose a patient to colon cancer. So colon cancer is the third most commonly diagnosed cancer in the United States, and it is also the third most common cause of death from cancer in the United States. It is estimated that 150,000 people will be newly diagnosed with colon cancer this year, and 50,000 people will die from colon cancer this year. So screenings are very important because colon cancer is actually considered a preventable cancer. Colon cancer usually starts out as a polyp, and a polyp is just a tiny little growth on the wall of the colon. So when we do a screening colonoscopy, not only are they diagnostic, where we can diagnose a cancer or a precancer, but they're actually therapeutic. So if you have a polyp, we can remove it so it never has the potential to turn into cancer. So one of the things that I hear a lot of, I don't need a screening because I'm not having any symptoms. Those are the people that need the screenings the most, because polyps don't cause symptoms. Usually you don't have any symptoms until a cancer is more advanced, where it's causing an obstruction or problems like bleeding. One of the concerns that I hear from patients is they're afraid that they're going to be awake for a colonoscopy. We do use an anesthesia provider, which means that the patients are very well sedated during the procedure, and they wake up in the recovery room and everything's already done. Colon cancer screenings, they're not a one and done. It's not something that you do it once and you're good forever. For people at average risk, if they have a normal colonoscopy, it's every 10 years. If they do have one of the risk factors like family history or a personal history of polyps, that interval is shorter. And that depends on just patient risk factors, and that's individualized for the patient. People are worried about pain during or after the procedure. As I said earlier, the patients are sedated, so they should not have any pain at all during the procedure, and it's really unusual to have any discomfort after the procedure. Some people might have a little bit of bloating or gassiness, and that passes very shortly. One of the changes that has been done over the years is we used to use air to inflate the colon, and people sometimes had a lot of gassiness and were very uncomfortable afterwards. We now use carbon dioxide, so it's a much finer gas. It absorbs a lot faster, so people don't have the discomfort after that they had 10 years ago, even when we were still using air to inflate the colon. So men are statistically more likely to develop colon cancer, but it is in women too. So really everybody should get colon cancer screenings starting at age 45, and even sooner if you have any risk factors. So if you are due for your colon cancer screening, you can either call our office to make an appointment or have your primary care provider send in a referral to our office, and we'll get you scheduled. You first have an office visit with either me or one of our surgeons to discuss medical history, what medications you're on, any past medical history that we would need to address before scheduling a colonoscopy. Then the colonoscopy itself is scheduled through the hospital, done at the hospital on outpatient surgery. It is done on an outpatient basis, so you get to go home the same day. If you do have any polyps or any areas of concern, we would remove the polyps and then go from there.
Do you feel good?
I feel good.
All right.
My palms are so sweaty.